The following is paid for by Advanced Physical Medicine of Miami.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Welcome to Healthy Dose Radio. I'm your host, Dr. Joe Gambardella with Advanced Physical Medicine and Rehab of Miami. You can find out more about us by visiting our website, apmrmiami.com, and by calling the office at 305-598-8788. I'm here today with Rob. He is our office manager. How you doing, Rob?
I'm doing good, doing great.
And I'm really pleased to be with one of my best friends, someone I consider to be an esteemed colleague, Dr. Buzz Korth. He's out of Columbus, Ohio. And just to tell you a little bit about Buzz, he is probably one of the most successful chiropractors in the country. He has postdoctorate degrees in anti-aging, bioidentical hormone replacement therapy, and a fellowship in stem cell therapy. And we took those courses together a little bit ago, and we're still going with the education, right, Buzz?
Oh, yeah. It was amazing.
So what I want to talk about...
we kind of got into this together, Joe, and, you know, over the years, I think we were talking yesterday, you've done about 4,000 cases of regenerative medicine, you know, and we're about the same. So, I know we collaborate quite a bit. So, you know, we're talking 8,000 to 10,000 cases between both of us. So I'd love to get with you and pick your brain and pick my brain. So we definitely have a lot to share.
Yeah, I think the audience is really going to want to hear about this today because we're going to be talking about some of the most difficult conditions to treat, which are chronic degenerative conditions, which start to affect just about all of us, whether it's neck pain, lower back pain. We're also going to talk about ways to fix them and how the body can actually recover from those difficult to treat conditions. But I think before we start that, you know, we always like to talk about how the body breaks down, why you get into a position where the body cannot heal. So what do you know about inflammation?
I always tell patients that really to understand how, you know, using these allografts with stem cells can heal your body, you really have to understand how you broke down in the first place. And most people don't even understand how their body got there. We just think that, you know, we get old and that's part of normal aging. And although it's common to have these conditions, degenerative arthritis and things, as you know, it's definitely not normal. You know, and you see this in your practice. You know, we have some people come to our practice in their 70s and even 80s that work out, jog, and they're in great shape. And then I have other people come in their 50s and they're just a mess. Exactly. You know, and it's all a function of how we break down with age. So I think that'd be a great place to start. I
think people, when they come in, all that they really are aware of or concerned about are the different types of stressors that they have. So they'll tell us how they got injured. They think, you know, it was the working out, it was the CrossFit, it was the years and years of baseball injuries or working out with good form, bad form, but whatever it is, they're just at a point where those physical stressors have caused them to become deficient and to actually, you know, develop a chronic pain condition. And we're really experts at looking beyond that at the biological systems in addition to. So we look at complete blood work, which addresses things like adrenal function, neurological imbalances. Is the body toxic? Is the immune system toxic with heavy metals? We look at digestion, metabolism, and most importantly, hormones. And one of the things I wanted to bring you in on, Buzz, is, you know, we're pretty adept at understanding about testosterone playing a huge important role in as an anti-inflammatory, the strongest anti-inflammatory really known to man that exists in all of us. But what in your opinion is about the age range where you start to see that hormone decrease significantly?
Yeah, that's a great question, Joe. And, you know, and this is not even debatable, society as a whole is becoming more low T. And there's a variety of factors. Is it, the BPA's in the plastic? Is it our cell phones? Is it the blue light? There's all these different factors, but testosterone's coming down. And LabCorp, for the very first time, just last day, it was in July, actually decreased what they deemed was normal testosterone. The reason they decreased it is because as a whole population, testosterone is going down. So they just changed what they defined as normal. Mm-hmm. Not really taking into effect, well, there's something wrong with society in general, right? And I think it was a 360 to 241. I could be off on those numbers. Yep. You might know better. That's a problem because I can tell you at least what I see clinically. When you have an individual whose testosterone, we're talking about serum number, which we really don't use to judge, but, we'll just see, people know this, a serum of 241, there's no way that person's going to have energy. They're going to have brain fog. They're going to have sexual issues. They're not going to feel good. And that's what they're defining as normal at this point.
Yeah, but yet when they go to a primary, the doctor say, hey, your testosterone is normal, no problem.
Well, just to bring some light on that subject, the way that they actually came up with those scales of normalcy is just by surveying people over time. And what they did is they surveyed people in their late teens, early 20s, all the way up through their 70s. And they found out that the average 70-year-old who functions like a 70-year-old that hasn't worked out, that has low energy, more fat than muscle, chronic inflammation and pain, their average testosterone is about 248 to 350. And the average,
not where you want to be.
Not where you want to be. And the average 25-year-old has a testosterone level somewhere around 700 to 900 or higher. So what's happened over time is that doctors have confused optimal with normal. And just because you as a 45-year-old have a testosterone of 358 and it comes in on the scale as being normal doesn't mean that that is healthy for you, right?
Correct. And I think the question you asked me earlier is what age do we start to see this? And at this point in my practice, we literally have thousands of patients on hormone replacement at this point. I tell people there is no age because I have people come in their 20s that are below 240, and I have some people come in their 50s and they're fine. So I don't think this is an age-related thing. It's a stressor-related thing. It's an environment-related thing. Are they on medications? But for someone to say, hey, I'm in my 30s, there's no way I have low T, that's a misnomer and incorrect. So, so if you're suffering with the signs of low testosterone, brain fog, inflammation, lacking energy, sexual dysfunction, get your blood work done because the blood work never lies. And in your practice, I know you practice identical to what I do. All we do is supplement. So if someone's hormones are decreased, we simply give you the exact same hormone that you're missing and supplement you to get you back to where your optimal levels will be.
Exactly.
It's that simple.
And if someone was looking for just a reference range, cookie cutter, which it's so much more than this, but, on average, when you look in textbooks, the general consensus is between 30 and 35, you're going to have the biggest decrease or drop in hormone that you'll ever have in your life. And people will be younger than that. People will be older than that. Ironically, when you're looking at other things that influence inflammation and chronic pain, you lose the ability of your body to utilize oxygen between 30 and 35. So they all kind of parallel and dovetail together. If you're utilizing less oxygen, if you have less anti-inflammatory hormones, you are going to have more chronic pain. And I tell my patients this, Buzz, what are the typical ages when you see these elite level athletes start to drop off?
Yeah, you see it, in their 30s, there's not many athletes in their 40s that keep at that peak level, especially if their sport just, needs them to have strength and endurance, right? So, the question, the question posed, do your hormones decrease because you're getting older, or do you get older because your hormones are decreasing?
It's a great question.
About that?
Yeah, it's the chicken or the egg. And, it leads us to ask the question, so what is health? It's not just the absence of symptoms. It's not just the absence of disease, not the absence of abnormal tests, but it's the presence of something. It's the presence of hormone deficiency and the inability of the body to use oxygen. And that's
I agree with that 100%.
A great point to start, because when you have inflammation...
Because you look at the areas that people break down with time, Joe, the people, knee pain is a big thing that we get amazing results with. But when people come to us with knee pain, it's not the muscles around the knee, right? Although the muscles work just as hard as anything else, if not harder. But it's the tendons, ligaments, and joints. And the same thing with back. I mean, a person's back muscles work all day long, every day when they're standing. But not often do we find problems that have degenerative back muscle problems. It's the joints and it's the disc and it's that lack of oxygen, which I think you can do a great job of explaining.
Yeah, what I'm actually showing you right now is a really good illustration of a connective tissue in the body, because we're talking about really with every chronic condition that we see that involves degeneration, we're talking about lower back discs, neck discs, labrums in the hip, labrums in the shoulder. And all of those tissues are pretty much synonymous. The meniscus as well. They are simply discs that act as a cushion that give support to the joint that do not have a vascular supply. And that's the reason why they can't heal. Later on, we're going to get into stem cells and the role that they play. But primarily, if you don't have oxygen flowing into a tissue, it's not going to heal. The definition of that is hypoxia. And a human being without oxygen, you are going to have brain death. A joint without oxygen, you are going to have joint failure. And one of the things that is key when we start out this whole process of discussing how healing occurs is the role that inflammation plays. And inflammation is so important because it is a signaling to other cells in the body that there's a problem.
Yeah, I mean, inflammation is really a good thing if you listen to it and take action, right? I mean, it's kind of like the check engine light on your car. The check engine light on your car is a good thing. If the check engine light comes on, number one, slow it down, take it easy, and if it doesn't shut off after a little bit, go to a mechanic and get it checked out. Now, you wouldn't go to a mechanic for pain or inflammation, but pain is inflammation. So just to be clear, so if you're having inflammation, you're having pain. So if you're listening to the show today and your knee hurts, your back hurts, that's inflammation. So that's what pain is. Chronic inflammation, which is defined as pain for 3 months or longer, always leads to degeneration. And that's where the problem occurs, the degeneration of these joints, the degeneration of the tendons, the degeneration of the ligaments. That's when your body really breaks down.
Now, Buzz, what do you say to the patients who say, hey, but I'm taking anti-inflammatories and I've been controlling the inflammation, so there is no degeneration? What's the biggest difference between removing inflammation from medications and allowing your body to get rid of the inflammation in a joint?
Yeah, it's a huge difference. Robert, a very common anti-inflammatory is a corticosteroid, and I want you to think about this. So if you're listening to the show and your knee hurts and you go to your primary care, pretty much a standard of care would be, okay, they know the knee hurts due to the inflammation. So let's give you cortisone or corticosteroids that will shut the inflammation off. Now, the problem with that is, number one, you need inflammation to heal. And Joe, would you like to go in and explain? Because inflammation is actually necessary to heal because of the paracrine signaling.
So as a great concept that you bring up, Buzz, is because inflammation, we spoke about the reason why inflammation exists. That's your body's call to action, that something is wrong. And you brought up an excellent point, which is listen to your body for a change. It's not, we're not professional athletes where we're 15 years old and they tell you just train through the pain. If you want longevity, if you want function,
the thing is training through an injury. You can't train through an injury.
You have to listen to your body.
You can train around an injury, but you can't train through it.
That's an excellent point. And so it tells us two things. Number one, if it hurts, don't do it. And number two is that inflammation is your cell's way of signaling for help. It's actually called a paracrine signal. And humans communicate through verbal language. Cells communicate through a paracrine signal. That's the way that cells communicate, whether they are rebuilding, whether they're degenerating. Cells send out, when they are degenerating, I should say, they send out a paracrine signal. And that signal is paramount to any other signal that exists in the body for damage, when damage occurs. Stem cells are the ones that respond in the first line of defense when there is an injury to that paracrine signal. And the caveat is, as long as oxygen is available, those stem cells are going to move to the site of the injury and release what we call growth factors. And those growth factors contain different types of proteins, cytokines, different enzymes, all the raw materials that the body utilizes and needs to heal. I heard one of your podcasts, Buzz. I like the way you said it. You said they're like little pharmacies that come to the site of the injury. And once the body utilizes those growth factors, it begins to rebuild and lay down new tissue, cartilage, connective tissue, collagen, whatever it may be.
Correct. So think about this. So Robert asked, what's wrong with anti-inflammatory? So if you go to the doctor and he gives you a cortisone injection, like Robert had just mentioned, you do get rid of the inflammation, and it might temporarily get rid of the pain, but you also stop the paracrine signaling. You also kill the stem cells in the area. And we know from research at this point, each cortisone injection or corticosteroid injection, whether you get it in your back or your knee or anywhere, causes up to 8% bone loss.
Wow.
It thins the synovial fluid, which is lubrication in your joint, and it damages the tendons and ligaments. So you think about this. So you're killing the stem cells, you're stopping healing, and we know that lasts for 6 weeks. So if you've had a cortisone injection, that's one of the few reasons we cannot do a stem cell injection or an allograft that uses stem cells. If you've had cortisone and we put an allograft with stem cells in right behind it, it's going to kill them for the next 6 weeks. Mm-hmm. So we really do other things ahead of time. But you're stopping the healing process. So if you're doing corticosteroids of any type in your back or your knee joint, really you're just fast-tracking surgery. Because you're stopping the healing process, you're causing damage. It just doesn't make any sense. And that's why people are a mess.
So in other words,
That's
it's a short-term solution that's causing a long-term problem to become worse.
Well, it's like putting duct tape over your check oil light comes on, Robert, and you're driving to work, and everyone's in a rush. I mean, problem of society, everyone's in a rush. You're late for work. Joe's going to be mad at you because he likes his coffee in the morning or whatever, right, Joe?
Right.
And, you don't want to deal with it, so you put duct tape over the light and keep running. I mean, if you wouldn't do it to your car, why would you do it to your body? And that's what you're doing if you're using corticosteroids. You're kicking the can down the road.
So let's find out what people do and what can people do when they have this chronic inflammation, and now that they know that anti-inflammatories, cortisone injections may not be the best solution. We'll find out right after this.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
We're back with Dr. Buzz, and we were just talking about the role of anti-inflammatories in the inflammatory chronic pain process. The reason that they are attractive initially is because they do reduce pain temporarily, but midterm, long-term, they stop blood flow to the joint and actually make the problem much, much, much worse.
Yeah, and that's why, Joe, if you think about it, you're only allowed to get 3 of these corticosteroid injections per joint per year. If a doctor would give you 4, it'd actually be medical malpractice because the amount of damage and trauma that occurs due to the injection itself.
So let's talk about how we have been able to help these patients, these difficult, hard-to-manage patients. Remember, we're getting the worst of the worst. Patients come to see us when they are failed surgery patients. They have joint conditions that potentially require replacement, but their surgeons can't see them because they have metabolic conditions like diabetes. They can't get cardiovascular clearance. So our success rate is exceptionally high, even with the worst of the worst.
Physical therapy stopped working for them.
So we understand in this process that oxygen is key, and since decreased oxygen utilization is the primary cause of degenerative disease, it makes sense that that's what we want to get into the joint first.
Yeah, 100%. It's kind of like I always mention, people have heard of hyperbaric chambers. A lot of athletes use that. And it's the same concept, but it's even better because, instead of sitting in the hyperbaric chamber for, 45 minutes to an hour, we're actually able to put a higher concentration exactly where we need it, wherever the damage to the tissue is. And basically then oxidize that area and get your own stem cells. We all have stem cells. If we didn't have stem cells, we'd be dead. So if you're listening to the radio show, good chance you're alive, good chance you have stem cells. But those gets those stem cells to heal your area. And if you're listening and you doubt your ability to heal, I always tell people, if you got cut, would your cut heal? And you're like, oh yeah, my cut, if I get cut, it heals. Well, if your cut heals, that proves you have stem cells and the ability to heal. But why isn't your joints healing? Why aren't your tendons or ligaments healing? And the answer is because there's no oxygen there. If you think about a Band-Aid, Joe, the purpose of a Band-Aid is to prevent liquid from leaking out of your body. But yet a Band-Aid has holes in it. But we all know the reason a Band-Aid has holes in it is because if oxygen doesn't get to your cut, it doesn't heal. That's why we don't use duct tape on cuts. If you put duct tape on a cut, guess what happens? It doesn't heal.
And it actually gets
because
infected.
the stem cells of your cut can't heal it without oxygen. That's why a Band-Aid. So in essence, when we're injecting ozone into the joint, It's the equivalent of putting a Band-Aid with holes on it, a cut. It's getting oxygen there and getting your own stem cells to propagate healing.
So let's talk about that patient with the chronic knee pain. They've tried bracing. They've had some diagnostics, and they've been told that there's an injury to the meniscus. And for people that don't know what those cushions are, the meniscus, really the condition is the same. If you have a herniated disc or bulged disc in the lower back and it produces pain, it's the same thing if you have an injured meniscus. It's the exact same type of an injury, and the same types of conditions that don't work long-term to treat a lower back, whether it's anti-inflammatory medications or avoidance, are not going to work on a knee either. So let's talk about getting some ozone in there. The first thing that you want to do is ozone is actually put into the body in the form of an injection. So it is injected into the joint, and immediately a couple of things start to happen, Buzz, right? So you have some reduction in the inflammatory process because nerve endings are being calmed down. Yeah, I think you know that in a little bit better detail. You can explain that, right, with the C nerve fibers?
There's specific nerve endings, the TRPV1 nerve endings, which are pressure nerve endings. So any joint that's under pressure or weight bearing, like a knee or a hip, those TRPV1 nerve endings become hyper excited with chronic inflammation. And the amazing thing is when you put ozone into that joint, it literally shuts those nerve endings off. So a lot of people get immediate results. Like they'll literally get the injection and walk out and feel better just because we've shut off those hyper-excited nerve endings.
And it also, what it does is it opens the floodgates for your own stem cells to get in to treat the injured area. So once your stem cells get in there and they start reducing or secreting these growth factors, if there are enough stem cells present and there are enough growth factors and they're strong enough, the ones that are being released, your body is going to heal completely. And oftentimes when we do these conditions, if the patient is young enough and there is not enough degeneration present, they will heal completely without the use of any other braces, pain medications, or loss of function.
You're just getting the body to heal itself. And I know a lot of people are listening here, and people say, well, isn't it dangerous to inject ozone? Well, ozone's not oxygen. Oxygen or O2 is what we breathe in. But ozone is O3, and ozone has no nitrogen in it. So there's no risk of embolism with an ozone injection. It's actually quite safe. There are people that even inject ozone directly into their bloodstream to treat Lyme's disease. We don't do that at our facility. I don't think you do either. But there's absolutely no risk with this injection whatsoever. And this isn't something new either, Joe. We were trained by somebody who actually learned how to do this. This is used extensively in Europe. Not really used here, and we could have another radio show about big pharma and conspiracy therapies and all that stuff. But at the end of the day, ozone, there's no drug company making money on ozone or ozone units. So you're not going to hear, it's not going to be taught in medical schools, which are run by the pharmaceutical companies by now. And another thing I think a lot of our listeners probably don't understand is even when people graduate as doctors, the only education you really get postgraduate is put on by drug companies. So they're not going to teach you about ozone and other things they don't make money on. So that's why unless someone goes, does the fellowship like we did through George Washington, that was like $25,000 or $30,000 that they would pay for the fellowship. I don't know. Unless you're paying out of pocket, you're not going to learn about these novel therapies that really work.
You bring up an excellent point, Buzz, in that ozone. First of all, two things was developed in 1785, so it has been around for a really, really long time. And secondly, I just came back from a conference this year, and did you know that that oath that we took when we graduated from school that said above all do no harm? It's called the Hippocratic Oath. Did you know that 40% of medical schools don't administer that oath anymore? And the reason why is because it is so difficult to live up to. But what I did? I pulled it just before the show, and one of the things that it says in there, third paragraph down, it says that, quote, "I will not be ashamed to say I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery." So I know we have absolutely no problem referring out to an orthopedic or spine specialist when it is warranted, but we definitely don't see that reciprocation coming the other way. In fact, when we refer patients or patients say, well, let me check with my medical doctor, 9 times out of 10 or 10 times out of 10, what are we going to hear?
Yeah, that's not going to work. There's no double-blind studies. And that's a whole other thing. A common question is, is this FDA approved? Well, it's never going to be FDA approved. It's not a drug. Only things that get approved are drugs. And FDA, just because something is FDA approved, this will never be FDA approved. Once again, it's not a drug. It's a donated tissue. But just because something's FDA approved has zero to do with its safety or efficacy. Opioids are FDA approved. How safe are they?
Great point.
I think you had a great day. Of drugs that are FDA approved, how many are recalled within the first year?
About a third of every FDA approved drug per year is either recalled for additional warning labels or pulled off the market.
So what do you really get with an FDA approval?
Exactly. It's safer than not to come to market, but who wants to take their chances with a 50-50 roll of the dice? And these are, just to be clear, we're talking about orthopedic conditions that people are utilizing these opioids and pain management tools like non-steroidal anti-inflammatories and muscle relaxers to treat chronic pain, but are doing absolutely nothing to heal the joints. What I want everyone to do is join me Wednesday nights at 6 and Sunday mornings at 9:30 to learn more about these stem cells, bioidentical hormone replacement therapy, and physical medicine. Visit our website at apmrmiami.com. And remember, repair, replace, and regenerate. I'm your host, Dr. Joe Gambardella, and I'll see you next time.